Condon, she is the New Hampshire State Director of the Advocacy for National Vaccine Information Center. Good morning, Laura.
Good morning, Ben. Thanks so much for having me on.
No problem. I appreciate you coming on. So HB664, I've had a little bit of time to talk about this and wanted to schedule you. This vote's going to go down today. I spoke to Senator Bob O'Dell yesterday, one of the sponsors on the bill. I should also mention that I did reach out to Senator Jeannie Foster, and she wasn't able to make it on the show today. And with that being said, why don't you explain 664 for the audience?
Sure thing. And actually, I listened to what Senator Bob O'Dell had to say yesterday. I did call him, and he made a brief phone call back to me.
Mm-hmm.
You know, it certainly does appear that he and perhaps some other senators have been given some misinformation on this, and that is quite troubling. So, and and there is admission that there's a lot that's not known about this New Hampshire Vaccine Association and what this will do. And so I've urged folks that, no vote's a safe vote on this. But what this is it's not necessarily really new, Ben. There's been a New Hampshire Vaccine Association in New Hampshire for 10 years now, and I have followed and have a file on this association, so I'm quite familiar with them. I know all the senators that got this on their desk said, geez, this is brand new to them, but it wasn't new to me, so I'm familiar with this association. And what this does is it was created to help raise the monies for purchase of CDC-recommended vaccines, which are different from the state-mandated vaccines. And the CDC recommended list is a list that it far exceeds what we mandate here in New Hampshire. So folks need to know that first off.
Mm-hmm.
And so what this does is this entity was created to assess health insurance companies and stop-loss companies. And stop-loss companies are, it's a type of insurance coverage that a self-insured business would purchase to provide a stopgap for medical losses so that they can provide for their employees health insurance covered through a self-funded plan is what they do. And that way they can, they're exempt from state mandates. It's an ERISA plan. It has federal regulations on it, but not state regulations. It's not insurance. It's a self-funded plan. So that's quite different. But they've been paying into this. And the claim is that that self-insured entities in the state are dropping their stop-loss, and so that they're no longer paying into this. Although that claim has been made, no one has supplied any evidence to that. In fact, I've heard discussion coming out of the insurance department. In fact, they're expecting greater numbers of stop-loss coverage as businesses seek to drop their health insurance plans and contain their costs and set up self-funded plans. So I'm not so sure that that claim even has any basis for it. So what they're doing is they're looking, they said, well, if you've got self-insured entities, large businesses, if they are dropping their stop-loss, or if you have municipalities that are providing for their government employees health insurance through a taxpayer-funded self-insured plan, and they don't have stop-loss, well, how can we assess them this vaccine tax assessment? And we can go after their third-party administrator who administers their plan. So this would expand this assessment basically to third-party administrators, so to force self-insured plans and municipalities into this program. And the premise is that this program is purchasing all vaccines ever recommended by the CDC, and they are stockpiling them in doctors' refrigerators. And they said, well, and the doctors are using them for every patient who walks through the door, even if it's a patient who's got a self-insured plan, which to me is improper use of these vaccines.
Sure.
Doctors have always had to keep separate refrigerators for those children who are part of the Vaccines for Children. It's a federal program for poor children, and that's what this is initially created to fund. And they were supposed to keep those vaccines separate because there are separate mandates on those children than there are for other children here in New Hampshire. And instead, they've been utilizing these vaccines delivered to their office. They talk about them being free, but we know they're not free.
No, we pay for them.
Right, we pay for them. In fact, I'm paying for them because I'm an Anthem policy holder. So, I've been paying plenty for this. So, if you were looking at the finances of this, the promise is that you're going to see your health insurance premiums go down. And, well, I'm not betting anything on that one, that I'm going to see my, insurance premiums go down. But that is the claim being made, is that, you share this cost. But my concern is, Ben, is that what this is this isn't a purchase program of the vaccines mandated here in New Hampshire. This is basically a wish list of every vaccine out there that's ever brought to market. And what happens is the CDC, once a vaccine is approved by the FDA, the CDC now recommends it. And that's real key, because recommending the vaccine is what gives the vaccine maker federal immunity from liability, the makers and the administrators from liability of all sickness, disability, injury, and death caused by their vaccine products. So it's really essential that they get that CDC recommendation. And, of course, this program is structured so that it purchases every CDC-recommended vaccine. And it works hand-in-hand with our Department of Health and Human Services. And the Department of Health and Human Services compiles a list of the vaccines that's recommended by the CDC, all the ones they wish to purchase. They calculate the cost of that. They subtract out what monies, federal monies are provided, what monies are provided through our state budget, and then they, let the New Hampshire Vaccine Association know that you need to raise X amount of dollars. Last year it was about $12 million. So you need to raise this amount of money to fund the balance. So when people say, well, it's not deciding what vaccines, but it's funding them. I mean, you can't separate the two. They're essentially linked, is what they are. So it's an existing program that really would codify this purchase of the CDC recommended list of vaccines, and that amounts to a list of some 50 vaccine doses before a 6-year-old can set foot in first grade. It's bad enough when New Hampshire mandates 30, but the CDC list goes all the way to 50 vaccines before a child can set foot in first grade. How many is too many, Ben? At some 50. Point, any rational person, and and I know that the Department of Health and Human Services and those who push vaccines and who have lobbied for this bill will say, well, no, it's not 50. It's really only 14 diseases. And I'm thinking, sure, I agree with you. It's 14 diseases, but talk to me about how many vaccine doses you're giving for those 14 diseases. It is 50 vaccine doses. Count it up on the schedule that you have on your website.
Wow.
It's not real easy to count because they make their schedule kind of cumbersome to follow, but there's 50. And, they seek to minimize it. I'm thinking, well, geez, if your product was so good, wouldn't you be real proud and pleased that you're injecting children with 50 doses of vaccines? If this is something good, you don't seek to minimize it. You seek to maximize it.
Yeah, you would think that they would be out there and out front. Laura Condon is the New Hampshire State Director of the Advocacy for the National Vaccine Information Center. We're talking about HB664, which goes to a vote today in the Senate. So if you don't want to see this bill come through, we'll have lots of information on our website about this. We'll link up with Laura on our Facebook page so that you can get this information. One of the things, Laura, I wish I could have you on for an hour. You obviously have done a little bit of study on this.
I've been following the vaccine issue for about 33 years.
Wow.
And I'm heavily involved in research for the last 7. I've been a director of advocacy for national vaccine information for the last 2 years. This particular program that we're linked with, it's called a universal purchase, and that's what purchases all the CDC recommended vaccines. Do you know that 44 other states have rejected a universal purchase program because it's too excessive and too costly?
Yeah, that's something I brought up yesterday. When you have 44 states, so that's more than 3/4 of the states. And you look at that, I have to believe that there are some states that really, let's face it, that really have an open book policy for government control. 44 states, there's at least a few of those states that say, wait a minute, this is too much.
New Jersey has rejected the universal.
That should say everything right
the
there.
Universal purchase. For Pete's sakes.
Yeah, it's crazy. But, one of the things, God, I only got a couple minutes here. I wish I had more time. One of the things that I find with this is that, there's several, this is like a tree with several branches. You can get into the whole vaccines and what happens with vaccines. Are we over-vaccinating our kids? But this bill, to me, really fits into a government spending issue. And one of the issues that I see with this, and this is where I joke around that my tinfoil tingles on my hat, but, I know that vaccines are a major issue within government for pharmaceutical companies who are saying we're not going to make vaccines because they don't pay. So I kind of feel like these types of bills are essentially a payoff to the pharmaceutical companies to keep making vaccines, and they say, don't worry, we're going to make sure you get the money on this deal.
Vaccines are the largest growing profit center of the pharmaceutical industry. I mean, they're growing, in leaps and bounds, and that's why we actually see the vaccine schedule. It used to be, when my daughter was born some 30 years ago, they'd update the schedule every 3 to 5 years. Now they're updating it on an annual basis, sometimes in between that if a new vaccine comes to market. I mean, the rush to get more and more vaccines on the market is absolutely huge. And I just want to, ask listeners, please call your senator if you haven't called your state senator. If the senator votes no on this legislation, with all the questions surrounding this and the fact that this does create a de facto mandate of a vaccine purchase program that far exceeds New Hampshire mandates, a no vote simply keeps the current vaccine association in place. It's going to continue to assess health insurers and stop loss like it always has. It will continue to raise the money that it always has to purchase those CDC vaccines. There's going to be no shortage. There's going to be nobody denied vaccines. So, a no vote is really a safe vote on this. A yes vote, really means that, you took that huge leap. We're willing to, extend this tax assessment to all businesses, including, these self-insured plans, which, I really truly think runs afoul of ERISA and puts the financial burden on taxpayers and in fact creates a de facto mandate. And I know I spoke to Senator Bob Odell. He actually didn't want to talk to me very long once I started sharing some facts with him. And he says, there's going to be a discussion about the vaccine mandates, next year, but of course had no names and where that was coming from. But I can assure you, if we are if we continue to expand this program, if we're now purchasing those 50 doses of vaccines, I can assure you I know what that recommendation for mandates is going to be next year.
Laura, I wish I had more time. I would like to get you back on after the vote and talk about that other side that I talked about. I feel, like I said, I don't have time to get into this, but I feel we're over-vaccinating the kids. I'd like to talk to you about that soon.
About the health issues, sure.
Yeah.
And this really, wasn't a bill about the health issues. We've discussed them a lot because, the very product it's funding, does affect children's health and many times in a very adverse way.
I'll be reaching out. Laura, thank you for coming on Live and Local this morning. I appreciate it.
Thanks so much, Ben. Have a great day.
Thank you.